Ladies and gentlemen, please welcome Peter Sands, Executive Director, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, Rajesh Panjabi, U.S. Global Malaria Coordinator, U.S. Agency for International Development, and Ellen Johnson Sirleaf, former President, Republic of Liberia.
Good afternoon, good morning, good evening, everybody from wherever you are in the world. I'm Peter Sands, and I'm the Executive Director of the Global Fund. And it's a great privilege for me to be sharing the stage here today with two of the people I respect most in the world of global health. President Sirleaf, who has been a phenomenal champion of health, both in her own country, Liberia, and across the world, and Raj Panjabi, who now is the malaria coordinator for the US government's presidential malaria initiative, but has also been right at the front lines on working on particularly the topic of today's conversation on the vital role of community health workers in delivering health to everyone, however poor, remote, wherever they live. Before I turn to President Sirleaf and Raj, let me just share a couple of thoughts to kind of set the scene a little bit. And perhaps, first of all, I should tell you what I do. The Global Fund is a unique partnership of governments, countries, civil society, communities, technical partners, and the private sector, all united to fight three of the earlier pandemics that hit humanity: HIV, AIDS, tuberculosis, and malaria. And in the 20 years since the Global Fund was created, the partnership has saved 44 million lives and has cut annual deaths from the three diseases by more than half. Yet, COVID has had a devastating impact on the progress we're making against these diseases. We've just published our report covering 2020 results, and for the first time in the history of the Global Fund, we've seen reversals on programmatic results across all three diseases. And this is despite huge amount of action by the Global Fund, its partners, to mitigate the damage of COVID. Indeed, as of August this year, we had made available, thanks to the generosity of donors led by the United States, $3.6 billion to help countries respond to COVID-19 and mitigate the impact on HIV, TB, and malaria. But the harsh reality is, however much we have tried, we are not going to get back on track against HIV, TB, and malaria until we collectively have got on top of this new pandemic. And getting on top of this new pandemic is going to require a comprehensive response. While vaccines are our most potent weapon, we are not going to defeat COVID-19 with vaccines alone. And Delta is showing us that in the way that it is driving surges of infections and death, even in the most vaccinated countries. In those countries with far lower levels of vaccination, it is causing havoc. So we need, simultaneously with accelerating vaccine deployment, to accelerate the deployment of tests, treatments, oxygen, PPE. Now, relevant to this discussion is that none of this happens without people to actually deliver the tests, the treatments, the vaccines, the oxygen to the people who need them, whether for COVID, HIV, TB, or malaria, or other diseases. And in many parts of the world, and particularly in Africa, those people are what we call community health workers. And there are more than 2 million community health workers in the countries where the Global Funds invests. And they are typically serving the rural, the hardest to reach, the poorest populations. And yet these people are far too often, and then most of them are women, 70% of them are women, far too often are overworked, underpaid if they're paid at all, under-equipped, and particularly in the context of COVID, underprotected. Tens actually Globally, well over 100,000 have died in the front lines of this pandemic. And this is a disaster for them and their families, but it is also a disaster for the health system because so many community health workers operate in contexts where there is no backup. If the community health worker is sick, there is no one else. And so the knock-on impact on the mortality and the health of other people is enormous. So as we think about defeating COVID, as we think about getting back on track against HIV, TB, and malaria, and as we think about being better prepared against new pathogens, community health workers are very much our frontline health workers, are key to resolving all those challenges. So with that, I'll start actually with you, if I may, Madam President. You, as I said, former president of Liberia, somebody who has led the fight against infectious disease in your own country and elsewhere. You've been co-chair of the Independent Panel Review on Pandemic Preparedness and Response. Given this perspective, what are we going to need to succeed? What would be the thing you would want this audience to focus on as the critical drivers of success?
Let me say how pleased I am to be a participant in this event. And I want to thank the Global Fund and the President's Malaria Initiative for the critical work both of those institutions have been doing to save lives. On the question of health crisis, Peter is so right when he says, vaccine alone cannot solve a problem and cannot respond effectively to a health crisis. I know this all too well from my own experience in responding to the Ebola epidemic in 2014, when our health system was caught off guard and came to be totally overwhelmed. We scrambled, trying to find how to respond to this disease. And in our response, we shifted to a community-based one. When we did, we achieved a turning point and saw that the community-based response was not only successful in curbing and ending the outbreak, but also proved to be vital to tackling other infectious diseases, such as malaria, which is one of the ones that plague us in most of West Africa. So for me, lesson number one, engage the community, empower community health workers. We saw the same in our work with the independent panel. Countries that had robust community engagement had more successful results in the COVID-19 containment. And as we're saying now, how important it is for vaccine delivery and uptake, and once again, community health workers, which will be the ones delivering it. And as you said, Peter, 70% of whom are women. So our lesson number two is that we have to build resilient health systems before the emergency strikes. And critically, this means empowering community health workers. Start with the community, and you can end outbreaks before they start. Reacting only after the health emergency begins puts us at a disadvantage in health emergency and behind in the race to save lives and preserve livelihoods. I hope that those in the audience are hearing this message. We need pandemic preparedness so we aren't caught in a cycle of response. Now is the time to isolate ourselves. It's not the time to isolate ourselves. It is time to work together decisively. Invest in the health delivery system that is the fastest way out of our current health emergency, and spend the next decade building that quality to prevent the next pandemic. You mentioned I've been privileged to serve in many roles. Well, let me say this. One lesson I've learned, that it is no one individual or no one institution can do it alone. It has to be a combined effort. The challenges we face, like Ebola or COVID-19, requires uplifting the community health workforce. And that is a target of our African Union strategy. So we ask that we all work together. We must act together creatively and decisively. That's why I hope with the other two partners, or the other two participants, that we can build this partnership with Global Fund, with the President Malaria Initiative, to be able to secure the support in training and equipment for community health workers because of the critical role that they play in saving lives and livelihoods. Thank you.
Thank you, Madam President. Raj, can I ask you to build on President Sirleaf's, in a sense, call to action here? You have very direct experience of the role of how community health programs can be made much more effective. And you're now in a position of PMI to think about, deliver on how those can be scaled up. Why do you see community health workers being so central, and what can we do to better support and make them more effective? And what role can private funding play in doing this?
Thanks, Peter. And let me say how honored I am to be here with you and President Sirleaf and the audience. You know, I have worked as a doctor with community health workers. I've perhaps learned as much in hospitals in training as I have at the, not just at the bedside, but or at the exam table, as it were, but at the kitchen table with community health workers visiting homes in West Africa. I grew up in Liberia. And so I've seen this, the power, but let me just make the business case, because we're here with the private sector and philanthropy. There's two reasons to invest in community health. First, test medicines, vaccines, and other prevention tools don't deliver themselves. We know that, but just think about it for a moment. The companies, philanthropies, and governments represented here have invested billions of dollars in purchasing hundreds of millions of tests, medicines, vaccines, and other preventive tools. But the world is facing a gap of over 18 million health workers. And Peter just mentioned another 100,000 have died during COVID-19. A lot of the remaining health workers are concentrated in cities. So these products that are created by the private sector are still out of reach of hundreds of millions of people, especially those in rural and poor communities. So we've found that if you hire, train, and equip the neighbor of a patient, train them in a few weeks, equip them with the tests and medicines in a backpack, give them a smartphone, they can go door to door, often extending the reach of clinics and hospitals to serve their neighbors. Essentially, it's about bringing care to people rather than waiting for people to come to care. And importantly, again, this is the private sector, numbers matter, and the impact just speaks for itself. Madam President Sirleaf just described the partnership between the government of Liberia, the Global Fund, the President's Malaria Initiative, and several philanthropies and companies that teamed up with President Sirleaf and the Liberian government following the devastating Ebola epidemic that affected Liberia to deploy a national network of 4,000 community health workers as first responders to detect Ebola in the next outbreak, but also, in addition to detecting 5,000 potential trigger events and responding to COVID today, that same workforce is testing and treating half of Liberia's rural children with malaria. And that's helped drive down malaria death rates in Liberia by over 50%. And speaking as someone who was a child in Liberia that had malaria several times, we know what that means for those children and their parents. But it isn't just Liberia. Thailand, I just spoke with our team there this morning. The Global Fund, the President's Malaria Initiative, governments there, the private sector have invested in enabling 1 million village health workers that have helped drive down malaria cases there by 90%. And El Salvador even eliminated malaria this year completely, in part by investing in thousands of community health workers. So, if outbreaks start in communities, then we have to invest in those closest to the community to stop those outbreaks. And I think that really brings me to my second reason I would put forward is that this isn't just good for the people community health workers serve. It makes it safer, the world safer for all of us. It makes our businesses more resilient. And that's because alarms, those early warning signs of the next outbreak, don't ring themselves. Alarms don't ring themselves, health workers do. And community health workers are the largest door-to-door fever surveillance network in the world. Malaria-supported community health workers, for instance, have tested over 2 billion fevers in the last decade. And that's a tremendous asset because fever, you don't have to have a medical license to know this, is the most common symptom of malaria, Ebola, COVID, and likely the next pathogen to wreak havoc on this world. So if we detect it earlier at the source, as Madam President so eloquently said, we will have lower chance that those threats will wreak as much havoc. And in fact, she cited the independent panel found that countries that invested in these community health workforces actually had lower mortality rates from COVID-19. And they include countries like Thailand that deployed those 1 million village health workers to do 8 million additional household visits in the first 2 weeks after the first potential cases of COVID were discovered. And now those same trusted neighbors are the ones we're going to need to rely on to promote the uptake of masks and COVID-19 vaccines. So this is critical, I think, both for the communities that we are all trying to reach with our medical interventions and healthcare interventions, but also makes the world safer for the rest of us.
Thank you, Raj. And I'm conscious we're up at time, but I am going to ask you, President Sirleaf, just one last question. Under your leadership, the Africa Frontline First Initiative is working with partners, including the Global Fund, to increase investments in community health. What's your message to this fabulous audience we have today? What are the concrete actions that they can take, that we can take to really take up and support the challenge of building even stronger community health workers in the way that both you and Raj have described?
I've come to realize that ideas and good intentions are not enough. Ideas must be met with political willingness and collaborative action. That's why I'm championing the Africa Frontline First Initiative. As I've said, frontline health workers, those closest to the communities, are both critical in responding and in being able to meet the critically rejected. The Africa Frontline First Initiative seeks to accelerate community health delivery in Africa as part of community-driven, resilient health systems. We hope to partner with governments, donors, implementers, and technical allies to accomplish these goals. And I'm pleased that we've been working alongside the team at the Global Fund to design and host a catalytic fund we are calling the Africa Frontline Community Health Fund. This Community Health Fund will support countries to scale and strengthen their community-based health services by building foundations for the rapid scale-up of community health delivery and improving system barriers to optimize quality and sustainability of community health workers. We must act in concert. And I'm glad that investment in this fund will be matched by the Global Fund through you, Peter, and that we will see the community investment will spur domestic investment, that our targeted work will inform the nearly $1 billion in Global Fund's community health portfolio. We look forward to working with the Global Fund and with country governments to accelerate this crucially important force. To private sector, philanthropy and foundations, I call on you to consider investing in the Africa Frontline Community Health Fund and help us best this pandemic and get ahead of the next ones. To the public sector, I urge you to really think how you can reduce the fragmentation of finance in the health space and work with us to align our investments. We can optimize our collective efforts by aligning investments, providing coordinated technical support, and holding ourselves accountable to the governments that we support. And so I invite all of you, all of us, to join in this initiative and reject by acting together any notion that COVID-19, malaria, HIV, and TB deaths are a given. Another world, a healthier and safer world is possible if we come together and act now decisively and collectively.
Madam President, Raj Panjabi, I can't really compete with President Sirleaf's eloquence, so I'm just going to thank you both and say to my audience, say to our audience, I hope you are listening. I hope you will act. Thank you, everybody.